Chapter 23, Vaccines. In this part of the lecture, I'm going to give some background information, first talking about the types of immunity. So there's basically two types of immunity. There's natural immunity, or what we call innate. It's where the body creates its own immune system and its own ability to identify and attack and destroy disease-causing pathogens. And then there is also acquired immunity, and that results from an external exposure, like through vaccines, drugs, or to a fetus through its mother, either through in vitro or through colostrum in the nursing of the breast milk component. When we talk about acquired immunity, there's two types of acquired immunity. There's passive immunity and there's active immunity. So there's components of passive immunity. There's naturally acquired passive immunity, and that's what happens when a fetus is in utero. It extends about for the first year and a half of a baby's life. And it's primarily composed with IgG antibodies, and that's immune globulin G, which is pretty effective against most viruses. Then there is passive immunity that's artificially acquired. So immune globulin drugs can be given after a patient is exposed to a disease, such as with rabies, to give passive immunity. Most of the vaccines have to do with active artificial acquired immunity. There is active naturally acquired immunity, and this occurs once someone's been exposed to a disease-causing pathogen, and usually occurs after a year and a half of life. This is when the immune system can kick in on its own. So this would be for things like if somebody gets chicken pox and their body builds up an immunity, then if they're exposed to chicken pox again later in their life, they don't get chicken pox a second time. Active artificially acquired immunity is the basis of vaccines. It's to help prevent disease from ever occurring in the patient. So when vaccines are developed, they're produced with the purpose of preventing occurrence of specific diseases, either caused by bacteria or viruses, that are potentially life-threatening or at the very least dangerous to the patients and can cause an epidemic or a pandemic. Your book gives a table of the vaccines that are covered in this chapter and identifies what their source is. So is the pathogen a virus or a bacteria? When we talk about vaccines, there's different types of vaccines. There's different forms. There's live but attenuated. We call it these attenuated vaccinations. Live, the bacteria is actually weakened, or the virus is a weakened form of it. They're grown in specific cultures so that they're weakened in its specific temperatures that don't allow it to reproduce properly, and it causes a mutation. So it makes an inactive virus, which of course would be less virulent. Now the term virulent has to do with the potency of the virus, and something that's less virulent, the patient's not going to have quite the same immune response to it. Now, it can still elicit an immune response, so the patient may have fever and probably flu-like symptoms, or a very, very mild case of whatever the condition is that the vaccine is preventing. Intact but inactivated or killed bacteria or viruses are also used to create a vaccine. The virus is actually killed with either heat or chemicals because it's dead, it can't reproduce. But what occurs is there's antigens on the outside surface which elicits that immune response from the patient. Another way that vaccines are formed are from subunits. So they take a part of either the bacterium or the virus and introduce that into the patient. So the same way that the dead viruses or bacteria could cause or elicit a response, that can happen with a subunit as well. The final way to create a vaccine is with a toxoid. So it's indicative of the toxin that the bacteria would produce. Now, this is only effective with specific gram-negative bacteria, and what happens is this toxoid kind of looks like the poisonous endotoxin that would be produced by the bacteria. So the body can produce antibodies against that poison that the bacteria would create. Now, the vaccines are either going to be monovalent, trivalent, or multivalent. There's also quadrivalent. So monovalent means that there's one strain. So it's a single strain, single type of antigen. Trivalent would be 3 types. Quadrivalent would be 4. Multivalent would be more than that. So different strains, your flu shot's going to have several different strains of flu that you potentially are going to be the ones that could cause the highest incidences of flu in the season. Pneumococcal pneumonia vaccinations are polyvalent. Quadrivalent includes things like Gardasil, which is used for HPV. Now, also, it could be a single virus for vaccine, or it could be that there are several within the injection. So, single virus combined vaccines are primarily mixing things that could cause a condition, a disease, that are on the same dosing schedule. So there's the measles, mumps, rubella, or MMR2 vaccine. There is a ProQuad, which has measles, mumps, rubella, and varicella, which is the chickenpox vaccine. There's also your diphtheria, tetanus, and pertussis, or DTaP vaccine, which would have multiple types of virus vaccinations in one vaccine. Now, many of the vaccines require boosters, so that means that they need either a second, third, or possibly fourth vaccine following the initial, and that's used to boost up the immune system after some time has elapsed, because the body can sometimes break down the immunity from a vaccine, or that extra shot just helps increase the amount, or boost, like the name says, booster, it boosts it up. Now, for example, adults need a tetanus booster about every 10 years. Many of the vaccines that are talked about in the drug portion of this lecture, polio has a booster, hepatitis B has a booster, so there's several of them that have a series. Even Gardasil, even the HPV viruses have booster shots. A concern with vaccines is allergic sensitivity, and allergic sensitivity to egg is one of the most common components to be concerned with. Many kids are allergic to eggs, although for most children they outgrow this about the age of 5. It is important to note that severe allergies may need to use caution with specific vaccines. The influenza vaccine and the MMR vaccine given in childhood may contain egg proteins. Some of these have been changed recently. I don't have the specifics of which brand it is that has phased out that component. There is, when you take a patient history prior to giving a vaccine, allergies listing is important. Some of the vaccines will contain more egg protein than others. For children and adults who have severe allergies to eggs, they shouldn't be given these vaccines. Now, it's important if someone is not able to be vaccinated, whether it be from sensitivity or if they are immunocompromised, that everyone else in the household is vaccinated, or other people that they will be around are vaccinated, because that gives a secondary protection for that child that can't be vaccinated. Some of the concerns with vaccines, the book talks about some additives, including aluminum or antibiotics, disinfectants, stabilizers, formaldehyde, albumin or egg protein, as I just discussed, and thimerosal. Now, thimerosal contains mercury, and that's one that people have kind of focused in on with the thought that vaccines can have an impact with autism, and all the studies have shown that this is not true. So that component is unfounded. So patients who have arguments against vaccines, it's actually they're creating a potential environment that could cause risk to patients who are unable to be vaccinated or whose immunity has been impaired due to autoimmune disorders or chemotherapy, taking immunosuppressant drugs and things like that. All right, so that just gives you an introduction into this chapter. It's going to continue on with the actual vaccines that are covered in the chapter. And as you go forward, just please keep in mind to, once you've viewed this presentation, you're going to do your worksheet and you're going to bring that to class on Monday, July 18th. And then you're going to do your online assignment and you're going to complete your quiz online for this chapter, and I have it so that it's due Wednesday evening. So if you do this on Monday as you were directed, it gives you an extra day versus class time. And then the next chapter will be posted. All right.